Hey everyone, and welcome to The Explainer. Today, we're talking about something that touches millions of lives, dementia. We're going to really break it down, what it is, what it actually looks like, and most importantly, how the right kind of compassionate care can make all the difference in the world. So let's just start right here. This one sentence, it really gets to the core of what dementia is. And you can see right away, it's not just about, being a bit forgetful. We're talking about a decline that affects thinking, behavior, and the ability to do everyday things. It literally changes how a person navigates their own life. It touches everything. All right, so let's start decoding. To really get a handle on this, we've got to start with the fundamentals. We're going to lock down a clear definition and take a look at what actually causes it. Okay, so let's look at the clinical definition, because the words here are super important. You see chronic and progressive. So chronic means it's a long-term thing, and progressive means, well, that it gets worse over time. And this next part is absolutely crucial. It's caused by organic brain damage. We're talking about a physical disease. Something is physically happening to the brain cells. This is a huge one, right? A question so many of us have. Am I just getting older, or is this something more? Let's clear this up. Look, we all forget where we put our keys sometimes. That's just normal aging. But dementia, that's a whole different ballgame. It's a significant decline, way beyond those minor occasional lapses. It's when things start to really interfere with daily life. So what's actually going on inside the brain to cause this? Well, it's super important to understand that dementia isn't just one disease. It's really a syndrome, which is just a way of saying it can have different causes. And as you can see from this chart, Alzheimer's is the most common one, by far. But there are others too, like vascular dementia or Lewy body dementia. They can all lead to these symptoms. All right, section 2. So we've talked about the clinical side. But what does dementia actually look and feel like for the person who has it? Let's dive into the tangible symptoms, and we'll start with a framework that's super helpful, called the 4 A's. This table is a great way to understand these 4 core challenges. So first up, you have amnesia. That's the one we're all familiar with. Difficulty with memory, especially recent events. Then there's aphasia. That's about language, struggling to find words or to understand what others are saying. Next is apraxia. This is about movement. It's the inability to do something familiar, like, say, buttoning a shirt, even when the muscles are perfectly fine. And finally, agnosia. This is when a person can't recognize familiar objects, sounds, or even the faces of their loved ones. And believe me, it goes way beyond just those 4 A's. Dementia also hits what we call executive functions. That's your brain's ability to plan, to make decisions, to problem solve. It can cause this deep disorientation, not knowing the time, the place, or even recognizing yourself. And when you put all that together, you start to understand the behavioral symptoms like agitation and why the ability to just perform daily activities starts to decline. It's truly a condition that affects the whole person. So, wow. Faced with a condition this complex, this challenging, how do we even begin to respond? Well, this is where we pivot. The goal shifts from cure to care. This next section is all about the guiding principles for an approach that's both effective and, just as importantly, compassionate.
So here are the goals of dementia care. And yeah, of course, patient safety is number 1, but look how much broader this is. It's about enhancing what abilities are left, managing the tough behavioral symptoms, and making sure communication can still happen. It's about promoting emotional well-being. And this one is so critical, providing support to the caregivers. You see, good care is holistic. It has to wrap its arms around the entire family.
So, that's the big question, isn't it? It's one thing to list all these goals on a slide, but what does compassionate care actually look like day to day? What does it feel like in practice? Okay, let's get practical. Time for our final section, care in action. We're going to break down the specific things that nurses and caregivers do every single day to turn those goals we just talked about into reality. This is basically the roadmap. First, you create a safe and structured environment. That's foundational. Second, you build a predictable daily routine. Why? To reduce confusion. Third, you change how you communicate. Clear, simple, and reassuring. Fourth, you manage behavioral symptoms, but with techniques that are individualized for that specific person. And fifth, and this is huge, you educate and support the family caregivers. You bring them into the process. Let's really lean into this for a second. When words start to fail because of aphasia, communication absolutely does not have to end. It just changes. A reassuring touch, a calm tone of voice, making eye contact, a smile, those nonverbal cues become the bridge. It's all about finding a way to connect with the person, not just manage a patient. And I really want to double click on this idea of routine. Why is it so powerful? Well, think about it. If your internal map and your internal clock are getting fuzzy, a world without a schedule would be terrifying, right? A predictable routine becomes an anchor. It provides an external structure when the internal one is failing. It brings a sense of safety and dramatically reduces confusion and anxiety. It's one of the most effective tools we have. And we just have to keep coming back to this, supporting the supporters. Because let's be real, caring for someone with dementia is a marathon, not a sprint. So helping the caregivers isn't just a nice to have, it is a non-negotiable part of the care plan. You have to educate them on the disease, teach them strategies to manage symptoms, help them find ways to reduce their own stress, and connect them with others who get it. It's absolutely vital. And this really brings us to our final thought. You know, a lot of the care we've been talking about happens in a clinic or at home, but the actual journey of dementia, that happens out in our communities. So we'll leave you with this question to chew on. How can we, as a community, as neighbors and friends, become better at supporting both patients and their caregivers on this incredibly difficult journey? What's our role in all this?